It's on like a cylinder, and there's like 2 holes I drilled through, so there's really like 4 spots that you can enter there. Now, what I want you to do, I have put some floss around this little key. See these little holes right here? Here's one. Here, I should really move it closer so you can see it. Let's see here. Okay, there we go. Okay, you see that one right there? Okay. Actually, I'll back it off for you so that you can do it. I want you to do it while you're here, because this is going to be difficult at home. Actually, it's better doing it here probably for like practice. Okay. Now,
tight.
What we do is that you put this around your wrist so that in case you would happen to drop this little key down there, you wouldn't swallow it, okay?
It's tight.
Okay, you'll see what happens. I know it's tight. You'll see what happens in just a minute. We insert this little key right in that little hole. Okay. Okay, just like that. It always goes in that position. And then you push all the way back until it stops. Now that's pretty far back, okay? Then you pull straight back and down. The most common area is that people like pull it forward as they pull it out, and then you can't find the next hole. Understand? Because now you should be able to look in here and see the next hole. You see the next hole? Okay. You'll always see the next hole as long as you make a full turn every time. Okay, now I want you to do this 1 time a day. I just did it today. We don't have to do it anymore. 1 time a day. Just do it in the morning or do it in the evening. And what I would like you to do is to lay his head down your lap with an overhead light. Don't try to get over the top and look underneath and have trouble doing that. So why don't I back this off? I want you to do 1 turn for me while you're here.
Okay. You do it once a day and then...
Once a day and that's it. That's all you have to do. Okay. So, here you go. Let me watch you as you do one. Why don't you come over
What
here?
I don't understand is, it seems like once a day is a lot. You just leave it?
That's why it's called.
It just keeps going?
That's why it's called like a rapid palatal expansion.
I
And
guess.
you're going to see a bigger space between his 2 front teeth. You'll see a space open up between his 2 front teeth. That's because the bone up here is actually spreading. It's a lot, but some people do up to 4 turns a day.
God, it just seems like a lot. It just seems
I
like
know.
more than it could.
Now, that's what happens. Otherwise, you get too much tooth movement. Okay, if you do it too slowly, then you get too much tooth instead of the bone moving. The teeth move. Okay? Open up real big here. You can do it from there, or you can do it over here. Where would you like to do it? Are you right-handed? Left-handed.
I'm right-handed.
You're right-handed?
I should
Then do it from over here. It's going to feel better when she does it, huh? Okay. Okay, because I sort of cinched it up a little bit. Okay. The other way, though. This way.
Do it.
Okay. Okay, now be sure to put it around your wrist. Insert it in there.
Well,
Okay,
it doesn't matter which way
That's
it's
fine.
turned, right?
And then just push it all the way back until it stops. Then pull it straight up, and you're done for the day. Okay? That's what you do once a day. You're the keeper of the key.
It is letting it go?
Well,
Okay.
I actually contracted it a little bit just so you could do it.
Okay, but I don't understand the process here.
Okay, we just
It's supposed to be
expanded it.
making it looser.
Wider.
Wider.
Well,
Okay.
we just made it looser because I cranked it a little bit tighter.
It's tighter than it should have been.
Right.
Okay.
Now, I want you to keep track of the number of cranks. I'm going to ask you, how many turns do you have on this?
Okay.
And when you come back, I'd like to see you in 2 weeks, and you should have somewhere between like 10 and 14 cranks, and by then we should have seen this little space.
Uh-oh.
And it'll actually get to be quite a big space by the time we're done. Now that space will close all by itself without us doing anything after we stop the expansion. This expander is going to stay in there after the expansion for about 3 months. During that time, I'm going to add the headgear. Okay? So what we're going to do on this is, after we have it expanded, then I'm going to fit a face bow on here, and I'm going to pull off of that, and the bone is all sort of like disrupted up there, and then we're going to move it back, and it'll go very quickly, a lot quicker than using headgear otherwise. Little tricks.
Okay, so you
Okay?
can just pretty much eat anything, or?
You can eat anything you can eat. It'll be just more, it'll just take a little bit longer to chew, that's all.
Yeah, okay.
So be sure to chew your food because don't swallow it whole, all right? It'll be a little bit less efficient. Instruct patients over age 15 that in some cases pain will result from the sutural resistance. Instruct these patients not to be alarmed, but to reduce the size of the turns to 1/2 and do these 2 times per day instead of the usual full turn once per day. If pain still persists, then reduce the turns to 1/4 turn for 4 times per day. Most researchers agree that the rate of expansion is tied to the amount of maxillary bone expansion. The faster rates of 2 to 4 turns per day are thought to result in more maxillary bone expansion with less tipping of the teeth. I have found more complaints of pain with 2 turns per day and more. 1 turn per day seems to be fast enough for good results and minimal patient discomfort. At 1 week, the midline diastema should show signs of opening, or the patient will report significant pain. Some researchers suggest that surgical assistance will be needed when the suture does not expand in 1 week. In several cases in the 20 to 25-year-old age group, they have met with success at 2 to 3 weeks with reduced turns and increased frequency in our office. A sutural resistance at 1 week is not a good sign, however. Be sure to log the number of turns accomplished to date in the chart and give specific instructions on how many turns to place before stopping. Schedule the patient for an appointment at that time period. After full expansion is obtained, tie off the screw with a ligature tie to prevent unwinding during the retention period. As a general rule, expand until the lingual cusps of the upper are the same width as the buccal cusps of the lower. Overexpansion of 2 to 3 millimeters is necessary to account for tooth uprighting and relapse. If the screw inadvertently falls apart during the overexpansion of the screw, then use cold cure acrylic to stabilize for the retention period. It is now necessary to wait for a period of 3 months to allow for reorganization of the suture. Some researchers feel that 6 months is necessary for rapid expansion, where 3 months is needed for slow expansion. Banding and bonding of the lower arch and the upper anterior teeth may be accomplished during this time period, so progress may be made on the case. During this period, transeptal fibers will close the diastema without appliance forces, and headgear traction has been shown to be more effective during this period, so you may want to request hooks or for reverse headgear or headgear tubes for cervical or hypo headgear to be soldered to the appliance.